Perfect. We're like 80% ready. We're good. All smiles from Linda. Welcome. This is the in-person meeting of the Board of Interpreters for the Deaf, Deafblind, and Hard of Hearing in Lansing, Michigan, that is also being live streamed and recorded. My name is Colleen Curtis with the Michigan Qualified Interpreter Program within the Bureau of Community and Health Systems within the Department of Licensing and Regulatory Affairs. Thank you to the board members and the members of the public who are in attendance today and those joining us by Zoom. Before we get started, a few items I would like to go over. The agenda and Zoom information are posted on the Michigan Qualified Interpreter website found at michigan.gov/BCHS. After the meeting, the approved minutes will also be posted on the website. The in-person meeting and live stream will be provided with ASL and captioning. People with disabilities requiring additional accommodations to participate in the meeting can email laura-bch-qualified-interpreter@michigan.gov. For the public comment part of the meeting, the in-person audience will give comments first, then those on Zoom. We are using the Zoom webinar platform and your video and audio are currently shut off. When it is time, participants on Zoom who wish to comment should type their comments in the chat feature. If you wish to be on the camera, click the icon at the bottom of the screen to raise your hand, and then we will recognize you and ask you to turn on your video and audio. Additionally, the board members and department staff are not permitted to respond to public comment. Public comments are limited to around 3 minutes. Thank you for joining today and for your patience. I will now turn it over to Department Staff Member Heather Keel to call the meeting to order.
Good morning, everyone. It is 10:14 a.m. I will first go ahead with roll call and then read the communication policy. Mitch Halali.
Here.
April Davidson.
Here.
Sarah Houston.
Here.
Leslie Pertz. Leslie is not present. Miriam Andrade Cuevas. Miriam is not present. Diana McKittrick. Diana is not present. James Check.
Here.
Rowan O'Doherty.
Here.
Linda Sikora.
Here.
With that, we have quorum, and I will read the communication policy. The following communication policy is proposed for the Board of Interpreters for the Deaf, Deafblind, and Hard of Hearing, and visitors to facilitate successful discussion and debate during meeting proceedings. It is intended that by following this policy, communication will be achieved for everyone present and will improve the effectiveness of the meeting. Board members should wait to be recognized by the chairperson to speak. The chairperson will recognize the speaker by name and allow for adequate discussion of all issues brought before the board. At any time during the meeting, if any board member or public attendee needs adjustment in communication facilitation, they should get the attention of the chair by raising their hand. All voice votes will be taken by raising of the hand. Avoid sidebar conversations. No comments from the public will be entertained during board discussion and should be held for the public comment section of the agenda. Board members are not permitted to respond to public comment, and the public comments are limited to 3 minutes. With that, we will move on to approval of the agenda. Mitch Halali.
This is Sarah. Make a motion to approve the agenda. Linda, I second.
Any discussion? All in favor, please say aye. Those who oppose, none. Motion passes. Moving on to election of the chair and vice chair. I will give that over to the department staff now.
This is Heather Keel. Okay. Just bear with me for a moment. I have to slide. We will now like to entertain nominations for chair. Are there any nominations?
This is Mitch. I nominate Linda Sikora.
There is a nomination by Mitch for Linda. Is there a second?
This is April. I second the motion. And this is Linda. I accept.
Are there any further recommendations or nominations for chair?
Sarah. I would like to nominate Mitch Halali.
There is a nomination by Sarah for Mitch to be chair. Is there a second? There doesn't have to be second. Okay. Is there any discussion on the nominations? The nominees can address the nomination if they so wish to.
What do you think, Linda? Do you want to say anything or no?
Linda. No.
Okay, I feel the same.
Okay, there is no further discussion at this time. There is a nomination for Mitch to be chair and for Linda to be chair. With this, we will now do a roll call vote. The nominee with the majority of the votes wins. Mitch Halali,
Linda Sikora.
April Davidson,
Linda Sikora.
Sarah Houston,
Mitch Halali.
James Check,
Linda Sikora.
Rowan O'Doherty,
Linda Sikora.
Linda Sikora,
You can abstain if you want.
I don't know. How do I do this? Do I vote for myself or vote for you?
You can either vote for yourself, or you could vote for me, or you can abstain and not vote.
I'll vote for myself.
okay. With that, Linda Sikora is now the chair for the board.
Thank you. Thank you.
And we will move on to . We would like to now entertain nominations for vice chair. Are there any nominations?
This is April. I would like to nominate Sarah Houston.
Is there a second?
I second that. This is James.
Are there any further nominations for vice chair? Okay, with that, our nomination is for Sarah to be chair. Is there any discussion from the nominee? You can address the nomination if you wish to.
This is Sarah. Nothing. No, thank you. Thanks. I accept, but nothing to add.
There is no further discussion at this time. There is a nomination for Sarah to be vice chair. We will now do a roll call vote. You can only vote for one nominee. The nominee with the majority of the votes wins. Mitch Halali,
And Sarah Houston.
April Davidson,
Sarah Houston.
Leslie is not in. Sarah Houston,
I abstain.
James Check,
Sarah Houston.
Rowan O'Doherty,
Sarah Houston.
Linda Sikora.
Sarah. Hu-
So Sarah is elected as vice chair. Linda, as chair, would you like to proceed with running the meeting? Linda, as chair, would you like to proceed with running the meeting?
This is Linda, not today, please. Keep it over there. I'm a chicken. Do
I love you. It's okay.
you want me to?
It doesn't matter. It's up to you guys. Am I still gonna run it?
Okay.
Okay. I can do that. So we're on number 5, right?
Yes.
Is there any motion of approval of the minutes for last meeting on February 14th? And this is Rowan. I motion to approve the minutes from the meeting of February 14th. Anybody second that?
This is Linda, I second.
Any discussion? Any modifications, changes? Okay, who's all in favor? Please say aye. Any opposed? None. The motion passes. Moving on to number 6, old business, we have none. Moving on to number 7, new business. I'm gonna move that over to the department staff.
This is Heather Keel. Under new business, we would like to please welcome Representative Matt Colazar to the podium.
Microphone on? Yes. Sound good. Okay. Good morning. First of all, I really appreciate you giving me the opportunity to speak with you all today. I'm coming before you not just as a state representative. I'm the state representative from Plymouth, Northville, part of Livonia and Western Wayne County, but I'm not coming to you just as a state representative. I'm also coming before you today as the very proud son-in-law of 2 deaf individuals. And I have seen firsthand how difficult it is to secure that access to a qualified interpreter. Interpreters, simply put, we know Michigan can do better. We do have very stringent requirements here in Michigan for interpreters, which is a good thing. We want the best interpreters. However, when I speak with interpreters, I hear of the same problems. Unacceptable lag times in getting their testing results back. I oftentimes hear about questions on the test that are not relevant to the areas that they're looking to be an interpreter in. And so I come here today with a challenge. I challenge this board to do better. I challenge this board. If legislation is the answer, we can do that, but that's going to take time. If the answer isn't a rules change, I would love to work with all of you on this. And that's the challenge, is let's work together and let's increase access to interpreters. I could tell you countless stories. I could tell you about my in-laws having to sit in the hospital for hours in agony, unable to proceed with their medical care because you can't secure an interpreter. Even just today, my mother-in-law was supposed to have a doctor's appointment and they had to cancel it and reschedule it for Friday because she couldn't get an interpreter. So the only reason that her medical care was delayed was because she's deaf. That is the only reason, and that is unacceptable. Communication is a basic right. So I'm challenging you all, and it's a friendly challenge. Let's work together. Let's do better for all of Michigan's deaf and hard of hearing population. I know we can do this. It's going to take work. I look forward to your continued partnership, and thank you for this time.
Thank you.
Thank you. This is Sarah. I'd really like to thank you, Representative. Thank you for coming. You know that we want you to know that we are all, every single one of us has the same goal. And I myself personally, I am a parent of both of my parents are deaf. My son is also deaf. And I believe, and believe me, that access is my number one priority. But a good quality access is even better. So it is very important that you know, for me, it's very personal, close to the heart. And I am fighting for you just like you are. And I'm doing that for my parents as well.
Anything else?
Any other comments for the representative?
This is Linda. I'm not sure. I wasn't expecting to add anything. This is April. I just want to echo what Sarah just said, that all of us here, that's our goal. You know, we know there's not enough interpreters and there's not enough quality interpreters that have the skills here in Michigan. And you're right. You're exactly right. The rules, the law, we do have a strict rule here set in Michigan, but we want those quality interpreters here in Michigan. And that's what's important. And we need to find a solution for that problem as well. But I agree. Diana here. I apologize. I'm so sorry I'm late. I'm here. I have the wrong attire. I had a foot injury and this is the only outfit that I could wear with tennis shoes. But talking about access, it's not only do we need more quality interpreters here, but we also need to provide we need hiring interpreters. Just recently, I heard, I'm not sure, 87% of doctors refuse to provide interpreters. Wow, what an astonishing number. And in my life, we have those doctors' offices have the call to try to determine my life and my death. Thank you for letting me interrupt. I apologize, but that's something that we need to work on.
This is Mitch speaking. Thank you for coming, Representative. Thank you for sharing your story, your perspective, and thank you for presenting this challenge to us and for wanting to cooperate with us on this as well. And everybody that commented, I mean, you guys are absolutely right. We are here for the same goal. And we have a lot of issues, you know, that pop up. It's not one solution that's going to bring all of the interpreters. You know, we really have to focus on all of these things. Like Diana said, it's a systemic issue. Who's responsible for providing these interpreters? Who's responsible for infrastructure in this way? We expect interpreters to, you know, show up last minute. You know, we have to remember they have a life. Most of the time when I get a call as an interpreter, I'm already booked for that time that they're asking me for. I always want to go and provide that service and help, but sometimes I can't because I'm already booked. So we really need to think about the structure, the system of it. You know, should hospitals and the medical system use contract interpreters, or should they use staff interpreters? So we need to have a big discussion about where in the system can we improve, because really it's many places. There's lots of room for improvement. And this is James speaking. So I have been, you know, throwing out tidbits like this really at every meeting. And when I look at the agenda, it says we have no old business. And I'm always disappointed in that, honestly. Like, what's up? What's happening? Is this the appropriate time to propose action for this meeting? Can we propose an action right now? Yeah, go ahead. So I propose that the committee really identifies and documents specific reasons why we're seeing, you know, the lack of interpreters, the shortage. Okay. Because I am proposing the committee to really start doing that, to set that up. You know, we have all these ideas and notions of why, but I want to document that and have proof, you know, based on research. I want to have a clear outline so that we really can pull our sleeves up and start working, because we don't have that. We only have comments. So, you know, come on. I'm a little bit done with that. Go ahead. And Diana saying, I second that. And this is Mitch speaking. I see a motion to form a subcommittee, and it would be their responsibility to hone in and identify and document the reasons that are the cause of the perceived interpreter shortage here in the state of Michigan. I see a motion from James Check. I saw Diana second that. Is there any discussion?
This is Diana. I would like to mention that this is a great idea. This documentation is great. But again, documenting, and then we pass it on and it just collects dust. You know, we need more of a commitment or something. Commitment to doing something. You know, there's so many committees where you just say, oh, we're gathering information, and then we pass this off to the next person and just a thick layer of dust settles. So please, you know, I want action with it.
This is James. Excuse my ignorance, but if we already have documented it, you know, it's there. If not, where is it? You know, I would like to see it. Do we have it?
Diana. Well, the DOD BHH, they do have
They had
a survey from years ago. They did in depth, and I'm sure we've all seen it. There was action on it, and then there was a lot of money spent on it. There was one place doing one thing, another place doing another, and it was the center of everyone compiled everything together. And you know, we had everyone, this information was separated. They had their business, they had their own business, and nothing came together in the end. And that's my beef with it.
And this is Rowan. I do remember that when DOD BHH kind of had that documented method that they were doing, but it was pretty much a general approach of what the deaf community needs, the shortages there, like in healthcare, etc. What we're talking about is more related to interpreters specifically and why there's a shortage. I think it would be better if we ourselves, this committee, document that and research that, you know, and not just have a general sort of approach to it.
This is Diana. Right. I agree with you. But there is some information that we may use that might we don't need to reinvent the wheel here. You know, we might already have a start, something that we don't necessarily need to start from scratch or start from zero. And then maybe we can get to maybe 75% and then it all comes back down to zero again. So, you know, this information from 0 to 75, that's my point. You know, we already have some basis.
This is Mitch speaking. I think that's a good point. I think that our community does have, you know, a gut instinct, a knowing of what the shortage is, where it's coming from. We've talked about this issue for a long time, and we kind of have an understanding of what the reason is. But official documentation, this board has not done that. I appreciate your concern about action as well. You know, I get also of why are we documenting it if it just collects dust, if there's no action, I get that. But I feel like we've been lucky with BCHS so far. So we have asked,
Yes.
they kind of do, it kind of works out. So I think it's a good start. I think we should have a subcommittee to collect and document data. And that's a good point. Let's use DOD BHH, their survey that they did in the past, just to start. We can take a look at that, kind of use some data from there. And then plus we can get involved with our BCHS survey. We can kind of use that as well. And BCHS staff is now doing a survey. We're planning that. That's in the works. I like this idea. If there is no more discussion, I will close this discussion.
No,
Oh,
no.
I'm sorry, April.
April speaking. I did want to add, that's a good place to start, like you mentioned, but also at our next meeting, we will have been inviting the ITPs to do their comments on their programs. And I think this might be a great opportunity to collect information from them as well. And of course, we know that problem is with education too. We need more interpreters in the field, and gathering information from the ITPs and then taking that in might give us a good place to start as well moving forward. This is Diana. I make a motion to close. To vote.
This is Mitch, all in favor. Oh, do you need a second?
It was seconded by,
James said, yeah, it was
James.
from Diana.
okay, motion by Mitch. No,
No, it's for the closing vote. Or do you mean the motion? The original motion? By James. And then Diana seconded. That's for the original motion.
okay, thanks for the clarification.
So now we're gonna vote. All in favor, say aye. Any opposed? None. The motion passes. So now I am thinking that we need to elect people for the subcommittee. I don't think the representative has to stand here at the podium the entire time.
I didn't want to interrupt. I didn't want to interrupt. I will just close my portion here by saying thank you. I'm glad to hear, and I look forward to working with you. Please know that my office
Me
is
too.
open to every single member of this committee. Anytime you want to meet to discuss solutions, again, whether it be through rule changes, legislation. Also, I think it's something that also is worth mentioning is this is a bipartisan effort. We're joined by Representative Aragona here. So you've got Republicans and Democrats that want to help. So please consider us a resource. Let's work together and let's increase access to the best qualified interpreters. Thank you, everyone.
What was your name? Oh, come up here. Say your name. Say hello. Come on. I want to recognize you. Yeah, we just want to recognize you.
Sure. Thank you. I'm Joe Aragona, from the 60th House District. You know, I don't think much more needs to be said after my colleague Representative Koluzar spoke. But this, you know, these types of issues are clearly not partisan issues. They're clearly issues for a subculture here in Michigan that we want to help. We want to be there for them. So I'll just echo that my office is open to any of you guys. If I can help in any way, please let me know. And we're excited to work on these projects for you. So.
Thank you.
Thank you.
Thank you so
Thank
much
you.
for coming.
Thank you.
And for your support. Thank you.
This is Diana. Mitch, did you already pick the chair?
I'm just running the meeting. We already voted though, yes, for Linda, and vice chair is Sarah.
Oh, and for the subcommittee?
Oh, okay. So do we want to discuss the subcommittee right now? Okay,
Might as well finish. Let's not leave this. ...
so who wants to start this discussion?
I'd like to make a motion for James. This was your idea, maybe to lead the subcommittee. I would love to help. But yeah, it's my motion.
This is James speaking. I am honored and I accept that. I would love to partner together. Yes.
Okay, we need more than just two on this subcommittee. Come on. This is April. I would love to help too. Linda speaking, me as well.
Linda, okay. So the four of you, are we satisfied with that?
I think we can start with 4. This is Diana. Start with 4 and we'll see if we need more later.
James speaking. I know there's some rules about how many times the board members can meet separately, or how many board members can get together and actually meet before that's called, you know, an open policy. So I'm curious, how many? It's 4, right?
A quorum, you can't have a quorum, so it would be 5. 5 is a quorum of 9 members.
Okay, so up to 4. Okay. So I'm kind of seeing a motion. Oh, go ahead.
This is Diana. Yeah, I make a motion. I'm making a motion. I propose that James be our chair for this subcommittee. And with the understanding that we cannot have more than 4 people on the subcommittee because of the Lara rules.
Just a clarification, it's not the Lara rules.
I'm sorry. Yeah, I'm stuck. I saw the Lara table.
All government, you know, it's an open meeting act. And a friendly amendment to your motion. Other members of the committee are Diana. Oh, it looks like we lost the screen back here. Let's pause for a second. Are we good? Zoom? Okay, all right. So a friendly amendment. Other members of the board of the subcommittee are Diana, Linda, April. That's it. And then James.
I second. Oh, I'm sorry. I made the motion. This is Diana. This is Sarah. I second the motion.
More discussion? Okay, closing vote. All in favor, say aye. Any opposed? None?
This is Sarah. Colleen, did you want to say something?
Thank you. This is Colleen speaking. We wanted to do some introductions of our Lara director and chief.
Oh, okay.
Chief officer. Okay.
Yes, please go ahead.
Sorry to interrupt here, guys. We just wanted to make sure we had, we have Marlon here, Marlon Brown, Director Marlon Brown of Lara. So he's here. And also we have Courtney Pendleton. They wanted to come and say hi to you and introduce themselves. So we're excited to have them. But if you want to come up, Marlon or Courtney.
Well, good morning, everyone. My name is Marlon Brown. I have the honor of serving as the Director of the Department of Licensing and Regulatory Affairs. First, I want to congratulate Linda on your election as Chair of the Board and Sarah on your election as Vice Chair. And Mitch, I want to thank you for your service to the board and also your willingness to preside over today's meeting. I also want to acknowledge our legislative partners who were here this morning. I want to thank Rep. Kolazar for speaking and also for challenging not only this board, but also our department to work toward increasing access to qualified interpreters and also making sure that that access is one of a high quality. So it's my pleasure to come here today representing a robust State Department of more than 1,700 hardworking individuals who are dedicated to protecting people and promoting business across all corners of Michigan. We license and regulate nearly 1 million entities and individuals, and we administer over 200 different types of licenses, including qualified interpreters. We do a lot within the regulatory community, but I'm here today because 2 weeks ago, I had the opportunity to visit the Michigan School for the Deaf and had a roundtable discussion with staff and also some of the board members here today about what we can do to continue to support Michigan's Qualified Interpreter Program. At that roundtable, I talked a little bit about how this year's budget includes a funding request of $800,000 to further support the department's work to bolster this important program. I realize that sounds like a small amount of money, but it will go a long way, helping to pass exam rates for folks who are trying to become qualified interpreters, reducing barriers for individuals who are seeking to become qualified interpreters, as well as enhancing our QI database and providing further support so that we can work with this board to do exactly what you are setting out to do through your meetings and through your subcommittee. And so I'm here today because at the conclusion of that discussion in Flint, I realized that there was more that needed to be discussed than what we could cover in just 1 hour. And so I made a commitment to come to this board to hear more about the things that you are working on, to understand more specifically some of the challenges and opportunities that exist within our deaf, deafblind, and hard of hearing community, and to further commit my support as director of this department to working with you to improve critical access to QI interpreters and to make sure that we are providing the best level of service that we can to this community. I would be remiss if I did not acknowledge one of my tremendous colleagues and partners along the journey, and that is Courtney Pendleton. She is our Chief Operating Officer within LARA, and she oversees the Bureau of Health and Community Systems and Health Services. She is equally dedicated to this program and to this community. And so if you cannot get directly to me, Courtney is just as good, if not better, in many cases. So I'm excited to have her as a partner along the journey. Representative Colazar was very passionate, and I love that his comments sparked some action by this committee to further document where the gaps exist in QI services. I'm very interested in what will come out of that subcommittee. And it won't just be a report that collects dust. We at the department are committed to taking whatever is recommended and looking seriously at that. And that's why I was happy to recommend to the governor and why she included in this year's budget the funding increase for the QI program. I get that more needs to be done. I will be the first to admit that. This is a first of many steps that we can take to support this board and to support this community. There are nearly 700,000 individuals in the state of Michigan that need access to QI services. And we realize that out of that population, there are only about 1,000 individuals who are certified as qualified interpreters. And that number is not as big as it sounds because half of that population actually lives out of state. And so we realize that there is a significant gap there. But my purpose for being here today is to stress that we hear you, we see you, we are committed to this program. As I said at the outset, we're committed to protecting people and promoting business and supporting the hard of hearing, the deaf, and the deafblind community is part of that mission here at LARA. So I want to thank all of you for the work that you are doing as advocates. I love seeing the passion that you bring to this discussion. And I said the same thing when I was in Flint. We have a lot of advocates that support this community and they're around this table, but they're also in the department. They're also talking to us each and every day. And so I want to thank you for your service on this board and your advocacy for how we can further provide needed services to the deaf, deafblind, and hard of hearing community. So I won't take much more of your time, but I wanted to be here to express my commitment, to express my support, and to thank you for your service and all that you are doing to help us achieve our mission as a state department. Thank you again. And if there are any questions or comments, I'm happy to take them at this time.
This is Sarah. I of course, want to say thank you. And I'm really, really impressed that you took the time to come here today and talk with us. And I always say,
I've always said that, oh, I'm sorry. Haven't used these ever. Sorry. Yes. I always, and I gotta sit on my hands, sorry. I am a coder. My parents are deaf. I'm used to signing. But I always say that, you know, first of all, I've been here actually since the beginning of time. Since the board has set up. I've been blessed to be able to be reappointed on this board, and I'm happy because now we're under the right roof. I've always said, we've always been treated like the redheaded stepchild, you know, like we've got y'all and yeah, you're here, but we really don't want to do nothing with you, you know, that type of thing. And for you to take the time out today and come out and say to us that you actually care. I didn't think I get emotional, but that you actually care about us really makes a big difference in the fact that I get up and early and get myself together and come out here every day to fight for my mom and my dad and for my son. So I'm really impressed, and I thank you for taking the time to come speak to us.
Thank you.
this is Diana. I also want to thank you for coming as well. I didn't know who you were, and Courtney as well. I hadn't been introduced to you guys. I believe that you can serve people well if you meet them. And I think that our deaf community, we need the opportunity to see who you are and you know, hear from them directly. It's easy to write words on paper. You know, we've got 1 or 2 people speaking for our group or whatever, but that's not right. You know, the service can multiply by being the deaf and hard of hearing community can see you. And I think that's a benefit to us, to you, to deaf people. If you can see each other, you can work together. You know, people and not just work in silos, but working together. So we appreciate you coming. And I understand those feelings that you're feeling, Sarah. We're all working for the same thing. And sometimes we wonder if it's worth it, and it is. It really is. Much love to you. Thank you.
Any other comments? Mitch speaking. Thank you, Director Brown. Thank you. I was lucky enough, myself and Linda went to MSD, Michigan School for the Deaf, for the roundtable discussion. And I felt that it was a very positive discussion. I felt like, I mean, again, we have been fortunate and blessed that we're under BCHS and, you know, ultimately Laura. The directors seem very receptive to our needs and our concerns. And it's obvious to me that you know, came with stats about how many deaf people are needed, how many QIs in the state of Michigan. We have 1,000 certified interpreters, but only half of them live here in the state of Michigan. That means that you actually did your homework. And I mean, wow, that's the reason why we just feel so taken aback, so impressed. So I can't thank you enough. Thank you.
Thank you, Mitch. Thank you.
Okay.
So the next agenda item under new business is partner updates. Do you want to proceed?
Do we need a break or not yet? What are you guys thinking? Rowan
So
said, I'm good.
Sarah, doesn't matter.
Okay, we're ready to proceed.
Thank you. Colleen speaking. The up on the partner updates, number 1 is MDCR. Annie, is Annie Rasky here today? Yes, thank you, Annie. Welcome.
I don't need the mic. Hello, good morning, everyone. I want to wait till the camera's on me. Okay, perfect. Good morning. This is Annie signing from Michigan Department of Civil Rights, DOD-BHH. I am the director. Here with me today are the liaisons and facilitators back here. First, I want to thank the Director Brown, and Lara staff and the board for inviting the Division on the Deaf and Blind Hard of Hearing. We also went to the roundtable recently, and it was honestly such a rich discussion. We had wonderful engagement, and you're right, Director Brown, 1 hour is not enough. We could spend all day discussing this, our experiences, our concerns, our needs, what's happening here in Michigan and nationwide with interpreters, access needs for deaf, blind, hard of hearing community. I want to let you know that one thing that really impacted me was the continued engagement and partnership between Lara and DOD-BHH. We hope to see that continue. And I think that's important also to forget that we do have the Division on Deaf and Deafblind Hard of Hearing Advisory Committee. We're always inviting people to come present and try to partner up, and that's why I'm here today. So a suggestion is maybe our next meeting is September 20th. We haven't decided the time and location yet. We're working that out now. You know, we want to make sure it's accessible, but I would love the idea of maybe sharing, the actions of the subcommittee as well, related to your work and what you're doing, and how the division and our committee could partner up with your work. I would be happy to give you survey results, or if you want a presentation from us, what's up, what's happening with our division. The survey results were released in 2019. COVID happened, so that kind of got off the rails, and we know that there's a lot of shifts within the field with ITP, with interpreting programs and all of that. So I think it's worth the continued discussion. So please know we're happy to partner with you in any way you need. If the subcommittee wants us to present, go ahead, email me, contact me. I'm willing to help out any way we can. So now I want to discuss a few updates and related to our actions so far since the last time we met. So the spring activities include providing workshops, training, presentations for community members and service providers. And one area that we've shifted some focus on is we're partnering with the Department of Attorney General, and that is Dana Nessel. She has what she calls a consumer protection team, and that's related to identity theft, scams, and whatnot. So we partnered with her office to go to different regions and host senior citizen events. They're pretty broad, anything that can involve the community, they're welcome to come. We've had 3 so far. This month, we will have one in Battle Creek and Linda, that's her area. And then May 23rd, it's 3:30 to 5. And then June 6th, it's in Garden City from 10 to 12. And we're working in collaboration with some other organizations who want more, involvement in that. So we're really thankful for the Attorney General for partnering with us and making sure they're aware of the deaf community's needs. They're really connecting with the community as well. And so right now, we have also been discussing a plan to meet with Lara in the next few weeks to talk about partnerships in relation to some incentives that we're working on. Interpreter correction. So we're working on those right now. And then plus, we're possibly discussing some training for educators. Our role at DOD-BHH and Lara's role as well. And some people in the community, are still contacting us thinking we're responsible for interpreter rules and legislation. We kind of have to divert them. So we really want to connect with the community and talk about expanding on those interpreting workshops, virtual or in person, just to continue that discussion. And last time I presented here at this meeting, I mentioned that we did notice a lot of concerns in relation to the medical field and access there, same as you guys, same things that you've noted. And and Laura as well. And the Michigan Hospital Association as well has partnered with us. We've partnered with them before COVID. So we're waiting to start more discussions on that, on what's going on in their profession and how they're working with their members. So we're possibly talking about developing a training session through their organization because they have many members. So it'd be easier to collaborate with them instead of just the two of us going to every hospital and trying to hone in on their system. So Laura and BCH has been involved in that discussion as well, which I think is important. So that's one area that we're shifting focus on and working with them. For the next meeting coming up, we want to do some research, some additional research and, discuss that. And we also just went to the Myriad social event last month. It's important, to connect with that great panel. I mean, it was a great discussion. I was so happy to be there. So I hope continued partnership with Myriad. I know we have a meeting actually later today to talk about some future activities. And then the last thing that I want to mention is the month of May 15th, the deadline for the PEHI, Promoting Equity in Health and Healthcare Interpreting, the grant there. So if you know any interpreters who don't really have that much experience in the medical field and want to take a free training, a 6-month training, please encourage them to apply. The deadline is May 15th. And that cohort is developed through Gallaudet University and Idaho State University. It's a 5-year grant program that they have, and we're just kind of, promoting information about that program. And that cohort, again, it's 6 months. That training it's online. And then once you're done, the next phase will include getting a mentor and doing some mentorship. So interpreters who went through that first cohort are now working with their mentors. I think that's it. Any questions?
This is April. Maybe you already mentioned it, but that PEHI cohort, do you want interpreters who already have a level 2, or is level 1 fine, or who are not yet certified at all, or who should be encouraged to apply?
This is Annie signing. Great question. So the requirement is to either have a bachelor's degree or something equivalent, and then at least 3 years of interpreting experience. And that's it. That's the only requirement.
April speaking. So a BA or equivalent. Okay, my understanding is that here in Michigan, obviously for BEI 1, it's only an associate's degree that's required. But 2, 3, can they still apply then if they don't have a bachelor's degree and they only have an associate's, or what's that look like?
Annie signing. So on the application form, the PEHI emphasizes that they do a case-by-case assessment. So if they don't have a bachelor's degree or an equivalent, they will decide. It's up to them when they do the screening. So even if you have an associate's degree, go ahead. They encourage you to apply anyway, because that's their goal of the PEHI program.
This is April. So just to clarify, 3 years of interpreting experience, but you could be like a educational interpreter, but you want to transfer over to medical eventually. You could then, correct?
Annie signing. Yes, that's right. Exactly right.
Thank you. And this is Diana. I wanted to add a comment about the presentation on scams and identity theft. I went to one in Flint, and wow, it was very informational. I learned a lot. I did enjoy it. And I wish there was more of that. There were some people who missed it. I know that who would have enjoyed it. And secondly, I wanted to comment on the May 15th. So can CDI and deaf people who want to become interpreters also apply for the cohort?
Annie signing. Yes, they include deaf interpreters as well. We already had one deaf interpreter go through the cohort, so they can.
Do they have to be certified, or?
No, this is Annie signing. They don't have to be certified. They just have to have at least 3 years of interpreting experience and then a bachelor's degree or an equivalent. And it's a case-by-case assessment. So yeah, they can go through the deaf program right now, or the program right now.
This is Diana. Thank you.
Any more comments? Okay, thank you, Annie. This is Annie. Thank you for your time.
This is Colleen speaking. Next we have MDE LIO. Unfortunately, they were unable to attend. Number 3, we have MDA. And they unfortunately weren't unable to attend today. Number 4 is the Michigan RID. And I'm not sure if they're here to give a report today or not. Oh, thank you.
Well, it's pretty small and crowded over here. I don't want to make it extra crowded. I prefer to take the longer way. Feels more professional, take my hat off, come back around, and I'm ready. I'm the mirrored president now. Got my different hat on. Feels good to look at you from this angle. My board members, you guys are looking good. Just want to let you guys know that. Dust some dirt off your shoulders. Okay, so at Mirrored, it's been a few months of planning and setting up these spring workshops and spring conferences. We've been doing a lot, and then there was some stuff we weren't able to successfully complete to have that conference. We did host on Friday, April 26th, an event that was a panel. And then plus we had a social event as well. That was the first successful, event that was hosted by Mirrored in a while. It's been a long time. Finally, COVID did mess some stuff up, yes. But yeah, we feel a little more self-esteem, that we've been taking strides in the right way. We do have to really outreach, get more outreach, get more connection, especially with our members. We need to figure out, what's the best plan going forward? How can our organization provide that benefit to interpreters in Michigan through collaboration to really lift up the community? How can we change our vision? Before COVID, the organization hit the ground running, and COVID hit, it really threw everything off the rails. And after COVID, just really trying to get back to our baseline, it's hard to keep up with how it used to be. Some things just aren't working. So I'm feeling good about our board. We're very motivated. We have lots of good ideas coming, but we do need to, I want to see more wins, I want to see more wins in our future. So that is our message for you guys. Do you guys have any questions? This is Mitch. Thank you, Mr. President. Okay, taking the hat off and going back. This is Mitch speaking. I propose that we have a 10-minute break. This is Diana. I second that. Okay, perfect. Any opposed? Okay. Meeting break has started. This is Mitch speaking. I'm going to start the meeting again. I believe we are ready for the department update.
Good morning, everyone. Almost afternoon. We've had a packed morning. Thank you, first of all, for all of your passion and sharing with the director, with the representatives. We really appreciate you sharing your stories and sharing your feedback. It's so appreciated and really helpful. I think that gives them a great perspective about what we're doing today. Or now, not just today, but now. All right. Can we skip to the next slide, please? So QI program overview. I know that many of us already know what we do here, but we like to just touch base at the very beginning about, what BCHS does. We proctor the TEP and BEI exams, certify individuals, including renewals, process renewal applications. And then the 3 credentials that we accept in Michigan are RID, EIPA, and then the Michigan BEI. All right, next slide. Oh, we can probably skip that. We weren't exactly sure where Director Brown and Courtney were going to come in, so we just added a quick slide. I will say Director Brown has been very supportive, very interested in what we're doing in this program. I mean, obviously he came here today and did his homework. Mitch, I think you pointed that out, that he did his homework and has been very passionate and supportive to try and help us get where we need to be. So good stuff. So qualified interpreter administrative rules. It's been a long time coming. We're getting closer and closer. So as you know, we've created the draft. We've filed the request for rulemaking. So that's moving along. What we're now working on is getting these in American Sign Language. You may notice that Larry is not here today, but when he comes back, that's one of our priorities to get rolling, is working with the board and trying to get that translated into ASL so that we can get the draft rules out in both English and in American Sign Language. And then also we are working on next we'll be sharing with Michigan Department of Civil Rights and MDE, Department of Education. So that will be coming. We would like to get their input on the draft rules as well. Obviously, some of the information in there could impact their populations that they serve. So we definitely want to get their input. We will be having, as we've discussed in the past, the town hall meetings. So those town hall meetings, I kind of feel like are going to be more of an open Q&A, feedback, kind of going through the rules. We will reach out to the board ahead of time just to kind of make sure that we're all on the same page. And if you have suggestions on how to do that, eventually, once we get through all of that, the draft rules being released, sharing with internal partners and doing the town halls, the next step would be the public hearing. Sorry, I had to think about what that was called there, but the public hearing would be next after that. Okay, next slide. Oh wait, are we on the next slide? We are. Thanks, Colleen. So we went to the Michigan Department of Civil Rights presentation, and that was in February. And Dr. McKee, am I saying that right? Yeah, okay, Dr. McKee shared about disability awareness in the healthcare settings, which was really interesting. Good presentation. We also attended the advisory council in April. So that was nice to be part of that. I know Annie mentioned that we partner with them. I also wanted to mention our collaboration with Texas. Last time, I think it was the last board meeting, we talked about BEI pass rates and what's going on with that. We know that the rates have always been pretty low. We know that we're concerned that, how are we going to get more interpreters if no one's passing? So we did reach out to them and talk to them about our concerns, and they had some good feedback. They do have a potential workshop that they can offer. Also some like supporting, like maybe some study guide type of things or some different activities that maybe the interpreters can do. They talked about mentorship programs. So we do hope to see that coming from them very soon. I think we probably have to circle back with them. It's been a little bit since we've talked to them, but they were talking about a workshop that they wanted to put out because they have noticed kind of the same thing, that this is something that people struggle with passing. So we are working with Texas to try to get that feedback and just sharing with them what our struggles are in Michigan, and how can we get people passing? Let's see. So this next update that I have, I'm really excited about our survey, our census survey that we want to do. We have started to work with Innovy, which I'm not sure if everybody's familiar with. But they are offering to work with us to do a census. Basically, there would be 3 phases. They gave us kind of like a outline of how they'd like to do the census. And so the 3 phases, the beginning phase is basically the planning phase. The second phase would be implementation. The third phase would be analysis, and then putting out what our data is that we find. So we would be doing the census for the deaf, deafblind, hard of hearing community, and then doing a separate census for our interpreters. Does that make sense? So two different ones. We wouldn't try to combine those surveys, but we are planning to work with Michigan Department of Civil Rights, Annie, and then we were recently pleasantly surprised to hear that Michigan Health and Hospital Association is willing to help fund this project for phase 1. So super excited about that. We will have more details. This is still in the planning phases, so I don't want to say we're 100% ready to go, but we're very hopeful. We've gotten past that initial, is this the company we want to go with? We've talked to a couple different areas about how best to do this. We do want to collaborate with Michigan Department of Civil Rights to make sure they're on the same page as us, and then making sure that NFV does meet the needs of Michigan and doing this survey.
This is Mitch speaking. Sorry to interrupt you. I do want to inform the board because I myself don't know about Innovy. They did let me know that it was, possible to collaborate with them, and I looked into it, and that company, Innovy, the president is Shane, last name Feldman. He's deaf. He's a deaf person, and before he was the CEO of RID. He's extremely involved in the deaf community and all of that. And then also, I don't know if it's the official name, I'm sorry, but Dalvin or Davin, either
Davin.
one of those, they're deaf. Yes. He's also a deaf person. So the 2 of them, I'm really impressed that they picked this company, Innovy. It seems like they're very specialized in this field, know and are familiar with the deaf and interpreting community. So I commend BCHS for picking that company.
I cannot take all of the credit because this lovely lady Deb over here helped connect us. So we can't take the
Thank you,
credit.
Deb.
She did make the introductions with us and had done some work with them. So thank you, Deb, on that. Okay, moving forward to the next slide, please. I actually just yesterday met with the Michigan Health Endowment Fund. They are a potential grant opportunity for the QI program. They're looking at both our substance use disorder programs and our qualified interpreter program to potentially provide a grant to us. It could be used for to support part of the census. So we're really excited. I met with them yesterday, and they were just really impressed with what has gone on, what we've done so far. And I also shared with them the needs for this assessment or this survey, and how important it is that we understand the needs of the community so that we can better support our qualified interpreters and getting interpreters into the industry. So they will be getting back with us, but again, I just met with them for the second time yesterday and kind of ran through the program ins and outs from the BCHS side. And so they're going to take it back to their people and come back to us and let us know what we need to do for next steps on that. So we're really hopeful that we'll have a grant from them to hopefully support the census survey. I put in here that we've been collaborating a little bit with Myriad and on talking about training opportunities and future conferences potentially to collaborate with them. So I know unfortunately we had to reschedule or maybe put on hold our interaction with them, but I did just want to mention that we are excited to partner with them and be part of their activities. We already talked about MDCR, and then sorry guys, hang in there with me. I think we're good on this slide. I covered everything. Colleen, we can move forward. Thank you. Interpreter training programs. I know we talked about having them come to this board meeting, but it's graduation season. I didn't even think about it. It's a little busy. So they asked us to push it off till October. And hopefully we'll have them at the October meeting. We have requested from them some data and statistics, but we asked them to, when they come, they can present on whatever they'd like. But there was a few data points that we asked if they could share with us if they had it. So we're excited to see them in October. I know Marlon touched on the roundtable discussion at this Michigan School for the Deaf. That was a really great conversation. I know Marlon kind of shared on that, so I won't spend too much time on that, but I think that was a really important discussion to have to keep our leadership involved. I know MDCR attended, our board. Thank you, Linda and Mitch, for attending. That was really helpful to have you at the table. So I think it was a great discussion, but just wanted to mention that our leadership was very supportive and it really kind of piqued their interest in what we've been doing. We can go to the next slide, please. Oh, this picture I love. So this is a mural that the students at the school actually painted, and each of the items behind us, this is from our visit at the School for the Deaf, means something. So it's a really cool mural. If anyone ever is in the area and doing work there, and at the school, I'd highly encourage you to check it out. It's a really interesting mural, but kind of tells their history. And then there's just the picture of all of us there. So we wanted to share that because we thought it was a fun picture. Next slide. So our favorite time of year, renewal season. We just wanted to touch on a couple reminders and helpful hints. We will be sending out the email renewal reminders coming up to our listserv, meaning to the qualified interpreter listserv coming up shortly. I don't think we've sent that out yet. Have we, Colleen? Not quite yet. So we're getting there on that, but we'll be sending that pretty soon. Just wanted to mention this is kind of a heavy year because it's the 4-year cycles that we're looking at this year. A lot of them, not all of them, but a lot of them we're having to look at. So this is a heavy renewal season. And we might have Heather Keel being borrowed by another area. So we're working on trying to cover that, but we will make sure that the qualified interpreter program is, we're getting through those renewals, that we have support. I've already had discussions with other areas about how we can best support them, but know that this is going to be a heavy renewal season for us. So we'll be doing our best to keep everybody apprised on what's going on. Other things with renewals, resending the documents from the previous years for CEUs are not necessary. So we just wanted to mention that. So just the current CEU certificates and transcripts are required to be submitted, but not the previous ones. We should have those on file. If we do not, we'll reach out to interpreters asking for additional information. So 4-year totals, I know sometimes gets a little tricky. And so just wanted to mention that if we get the 4-year total questions, we'll do our best to answer them, but those will have to be a little bit lower priority because of all of the questions in the renewal season going on. So that might just be difficult for us to get to because it is a manual count on our end and kind of going back through files and looking for that. But we will do our best to answer those questions as they come in, but just wanted to mention that. Let's see. If people are not renewing for a specific endorsement, it's helpful to make note of that. Existing endorsements, renew with your renewal application. No separate application is needed. I know that I believe there was some social media questions on that. And just to clarify that those endorsements can be renewed with the renewal application. A separate application is not needed. Next slide, please. Okay, renewal timeline graphics. This was something that the board suggested, I think, last year. So just including this, just talking about June 30th as our renewal period ends. And then the 45-day grace period, excuse me, July 1st through August 15th. And then after August 15th, reinstatements required. Next slide, please. Continuing education. This this is just some of our reminders about, what rules apply to continuing education, what the BEI and EIPA individuals will need to do, 8 CEUs during each renewal cycle, 4-year cycle. And that's under Rule 81. So if anyone wants to look back at those rules to kind of see what they need to do, that we wanted to cite that there. Same with Rule 83. Those talk about our endorsements, what we need for medical, legal, and deaf-blind endorsements. And then if there's specialty, then that would require 8.8 CEUs. Next slide, please. So this is not updated from the October one. I'm sorry, we had a little glitch with the rating, and so we had to resend some of the rating tests out because there was a glitch with they were not able to hear appropriately or hear correctly when they were doing rating on the recordings. And so unfortunately, when we're just being transparent, unfortunately, there was, I think, 7 or maybe 8 individuals that we did have to do 7, Colleen said, okay, 7 individuals we did have to retest, unfortunately, which is a big bummer. Of course, we're not charging them for that. Of course, we're doing everything we can to work with them to get that through very quickly. We haven't had this happen to date. We did get some updated stuff from Texas to try to hopefully update our equipment. And unfortunately, there was a piece of the equipment that wasn't working properly. So, but wanted to share that these are the same results that we had in the October season that I presented. We are waiting for a couple batches to be rated. So we have done plenty of testing. It's just we're waiting for them to be able to rate those ones and just didn't have the statistics in time to get to you. Next slide, please. Oh, that's it. We're good. I think we got through that pretty fast. Any questions or feedback?
This is Diana. Thank you for this information. This is great. 2 things that I wanted to ask. From all this information from workshops, different events, who should people reach out to for information? Just the board should they be contacting, or how, like out in the community, if there is, how do we know what's happening? If the deaf community wants to come or attend or something like that, who should we reach out to?
So I might need the board's help on this answer because I don't know if there is one place that lists all the community events. We get looped in, for instance, James reached out to us regarding Merid. Annie reaches out to us regarding MDCR's advisory committee meetings. Is that what you're asking? Or
Yes and no. For example, the MDA, Michigan Deaf Association, they were established and they had a Flint Association of the Deaf Club additionally. And there's also various deaf clubs all over the state. And then we have deaf senior citizens groups all over. And, I feel like, why are we not letting them know of these events happening? Maybe they would be able to provide some good feedback and just see each other. I think if we can get this involvement from the community and be able to get these services out, I know sometimes it can be, we're speaking on behalf of the deaf community, but there's opinions of various individuals out there, and it might be great to have others with other experiences and opportunities, or have just an opportunity for other people to be involved. That's my issue, and that's something that I just wanted to pass along. And how do we let them know about these events and to make people comfortable with us? Before you have these town hall meetings, we don't want them coming in, not recognizing anyone, not knowing BCHS, not knowing who Laura is. And, you know, I don't want that resistance. I want to be able to warm up to each other, so that when the town halls come, you know, we're more open, we're ready to share. We've already been able to ask them and get to know them. And, you know, this is government, you know, it's an important thing. And, you know, we don't want to hurry up and finish this. We want to, you know, we want to do it our deaf way. And so that's just something, I appreciate knowing Innovi, and that's wonderful that it's ran by a deaf person, and that's something that we just want to be able to make sure that we're getting other deaf people involved as well. And that's just me.
This is Mitch speaking. I would be curious about that because I agree with everything that you just stated. I wonder if maybe us, you know, maybe do we have suggestions about how to get it out there? Do we just send an email to FAD, to FAD, to the Deaf Club? What's the best approach for engagement? I'm wondering what your guys' opinions are on this.
This is Linda. I think, you know, if we know what's happening, then we can just send out the blast. You know, we can let everyone know. I can say, hey, are you aware this is going on? Why don't you spread the word? That's an option. This is Diana. Also, prior to that, you know, if we say, oh, I went to this meeting and then we talked about this, this, and this, and, you know, we're able to pass that information on, we should know, you know, who else we can reach out to if we're interested. Or if anyone else is interested, you know, if it's government and deaf community, you know, that's a big difference. It's a big divide. So, you know, it's like the Grand Canyon, you know, it's a big separation. So we don't know, you know, if the government is speaking and the deaf people are, you know, if I'm saying, wait a minute, who's speaking for me? You know, if they're speaking on behalf of the deaf community, we need to make sure this partnership is in place.
Sarah had her hand up first and then Rowan.
This is Sarah. I think what Diana is trying to say is get your face out in the community more. I know so far you guys have been making progress out there, but I'm wondering about, you know, not going to some of those big events as well. There are some people, hold on one second. We're going to back up for the interpreter to catch up. I want to make sure that you are reaching out to those people who are not going to these big events. Like I'm thinking about the Senior Citizens Club. Those are groups that get together. For example, the Flint Association for the Deaf, they have a Senior Citizens Club. And maybe even reaching out to them or to the nonprofit agencies in those organizations and those associations in the Flint area like CAC. And in Oakland County, there is DeafCan. You can reach out to those and places and say, hey, I want to have a meeting with the grassroots deaf. That community is who you want to engage, who you want to get together and get them to go. Is that what you're trying to say, Diana? This is Diana. That's right on the nail. Yes. Thank you. Thank you for clarifying.
And this is Rowan. I think for planning purposes for the town hall meeting, we really need to think about having a deaf person who is a moderator for that town hall meeting. Because like Diana was saying, there's a disconnect between government agencies and then the deaf community. There's just a disconnect. So maybe having some sort of partnership, you know, with a deaf person who is specialized in government policy and really knows about how the government works and whatnot, and have them moderate the town hall meeting and kind of help facilitate that disconnect. This is Mitch speaking. I have a question for you, Diana. Do you mean specifically thinking about the deaf community and that they should know about Colleen and Heather Keel and all of these people on the board meeting and or on BCHS and Larry? Or do you mean more like in general?
Just whoever the faces are. This is Diana. The faces of who, would typically go out in the public. Who would that be? We want to see them.
So can I ask a question? Because this is a lot of good information and suggestions. When you say go out into the community, if you have suggested events for us to attend, or if you would like us to host a certain type of event, we would love to know about those. We're slowly gaining like acquaintances and relationships. And so we think we're getting there, but there's places, I mean, Sarah, the couple that you mentioned, I hadn't heard of before. So I think that's where our knowledge deficit is. So if you're able to provide some of that information to us, we'd be happy to get out and try and participate in some of these. I think that's where Lara and BCHS's knowledge deficit is right now.
Mitch speaking. So it seems like Heather is asking us as community members, if we see any events, we should basically forward them off to them.
This is Linda. Yes. Yep. And Diana. At the same time, Diana speaking again. Yeah. We should be able to be proactive, and maybe the deaf community can invite you to come, as a guest, or like, who are you? Or maybe it could be a panel, several different organizations, CAC, your agency, MDA, various people who put them at the table so they can see who you are and face to face meet each other. And the deaf people are able to say, oh, you are a human. You're not just a robot behind the screen or something.
And this is Rowan. Well, deaf people do love social media. That's something to consider, social media. Maybe take advantage of that. Maybe have a Facebook page where you reach out. Maybe have a video introducing the different staff members that are working for BCHS. Show what you're doing, what the process looks like. I think that might be a good way to get the word out and to get information out, and to connect with the deaf community so that they do know who you are.
Absolutely.
And this is Mitch speaking. It would be beneficial. Oh, I'm asking, sorry, interpreter correction. Would it be beneficial for you guys to have maybe a small subcommittee of us to kind of document and keep track of our knowledge of important agencies or locations or, people that are well known in the deaf community and also the interpreting community? Maybe have like a compiled list that we can hand off to you guys. Would that be beneficial?
Yes, I think that would be wonderful for us to know who we need to connect with. Like I said, it's kind of a knowledge deficit on our end. We are trying to get out there, which you guys know, obviously. We have utilized, Facebook, YouTube. Hopefully you guys have seen some of that work out there. And we also have a listserv that we send out to anybody who signs up. That's the hard thing though with listservs and GovQA, is that people have to sign up for those, or they have to give us their information for us to reach out. So I think these are great ideas. We'd love to see a list or know about events that are coming up that you'd recommend that we participate with. If you're able to help us make connections, that would be ideal. We are looking and trying to partner with whoever we can to best advocate for the program. So great ideas. Thank you for the feedback.
This is Sarah. So that means we're going to need a motion to establish a subcommittee. Let's call it public relations. Why not? Or / outreach. So a subcommittee. I'm making a motion to establish a subcommittee on that. This is Diana, I second.
Any discussion? Finally, this is James. We finally have old business. Yes.
This is Diana. Wait, we have our other subcommittee too. That's old business. So we'll have 2 items under there.
Yes. Okay, so who votes in favor, say aye. Any opposed? None. The motion passes. And I do want clarification from the 2 of you. For the subcommittee, do we vote, as a board, or does the chair, are they responsible for selecting the members of the subcommittee? Or do we just decide? Okay, either one, cool. So is there anyone who wants to volunteer to be a part of that subcommittee, the new subcommittee that we're forming?
This is Diana. I will, with the understanding that other people will work with me as well. Got eyes over here, you guys.
Sure. I'm willing. This is Mitch. I'm willing.
This is Linda. Well, you're in anyway.
But if we have a meeting, it has to be less than 4 people. If it's 5, then we have to invite the entirety, of the audience and whatnot. My goal for the subcommittee is, this is kind of surface, mind you, but to start with an outline, a list of people to contact. I know that we can forward information onto them, but Diana's right. It's a little bit reactive instead of proactive. We definitely want to be proactive. We want, to keep that 2-way street of communication.
This is Diana. And with the understanding that, we might have our names out. Can I use your name, I guess? Let's say maybe we're doing something and I get an email and I say, oh, wait a second, I don't know who this is. If I don't recognize the name, if I don't know who you are, it might be something I throw in the trash. So
Good point.
those building bridges opportunities is really important.
I agree 100%. I think that it is really helpful for us to be able to share the message from not just us, like we can try and send it out, but it's helpful when you all share it. I know when we send out listservs, we include several other agencies and stakeholders so that the word does get out. So I think that's a great point, Diana. Thank you.
This is Heather Keel, just to clarify. So we have Diana and Mitch on the subcommittee. Is anyone else going to be included?
Diana, I volunteer Rowan and Linda as well.
That's fine.
Sarah says, Linda, are you in? This is Linda. Oh, yes, I accept. I thought I was already called. I thought on that subcommittee that I was already under. This is Sarah. Well, it's up to you. How many subcommittees you want to be involved on? That's your decision.
The more, the better.
Okay, so you accept being on this one? Yes.
Yeah.
This is Diana. Okay, back to my second question here. So for the BEI, so I've seen the test scores. Do they not even offer any sort of suggestions or ideas or concerns of just like Michigan people aren't passing, that's it? Or, thank you, we've collected the money. Is there anything else that they can offer?
So that was something that we did talk to Texas about. What was the areas that they're seeing people are not passing? Colleen, can you help me remember what the one area they identified?
This is Colleen speaking. So Texas identified the receptive portion of the exams that there's difficulty voicing what the deaf individual is.
This Diana, that's nothing new. That's old information.
They also mentioned that if you have your BEI basic, that perhaps you spend more time interpreting in the field and then apply to take your advance. They thought perhaps people were passing the basic and then immediately signing up to take the advanced.
And to add on to what Colleen was saying, we do have a mentorship, I believe it's called an application, isn't it? That they can do. And then there's workshops that Texas is starting to develop. Colleen, did you want to clarify what the mentorship piece was?
This is Colleen speaking again. So the mentorship procedure that we have listed on our website is an opportunity for a basic interpreter or a BEI 1 to mentor with someone, be a mentee with a mentor at an advanced level. So we're hoping that people take advantage of that and can maybe gain some experience if they want to do that.
Thank you.
This is Mitch speaking. I do want to clarify, our current rules do allow for a BEI 1, a basic, interpreter with an advanced interpreter in that advanced situation, but they have to follow specific, procedures and policies. So they posted stuff related to that on the website. There is opportunities for experience for, a BEI 1 to really get immersed in the medical setting and see what it feels like. But there are a lot of requirements. Of course, the first requirement is that a deaf person has to allow that. It's the same as if you go to the hospital and you see, there's a residential nursing student there kind of studying, mentoring under first they'll come in and be like, hey, is it okay if they come in here? And then they'll go and talk with the doctor and then they'll both come in, with the student. So it's kind of a similar idea. This is James. James, check. So are you running that program, that mentorship program?
No. It's short answer, no. So there's a application that they fill out basically saying, and Colleen, correct me if I'm wrong, that they will have oversight by somebody who is qualified to provide that oversight. They turn that in. And does that make sense? Okay.
This is Mitch speaking. So that means there's no formal program, which means that we are essentially trusting these interpreters, the advanced interpreter, and then also the basic interpreter to understand the rules and to understand that the advanced interpreter is accepting a risk at that point. Anything that basic interpreter does on that assignment will reflect on that advanced interpreter. So when the advanced interpreter accepts them as a mentee, they must trust that will work out, that they'll follow the procedures, that if communication derails, they will get involved and fix that. So really the risk is on that advanced interpreter.
This is very similar to the process that we see with other licensed individuals. So for instance, I'm a nurse, so it's easy for me to talk about that piece. When I was in nursing school, I went to the hospitals, did my clinicals, and worked with them to develop my skills, right? And this is kind of similar to what we're expecting. That nurse, I was working under their license or my nursing instructor's license. And so that's a similar way that we're expecting this to be run, Sarah.
This is Sarah. Is the department aware of programs that are already established that do mentoring? Or are we sharing that information? Should we be? Like, I know Hurley Hospital, they do mentoring. They have a mentoring program already set up. And that's for BEI 1 applicants to go in and gain that hospital, that medical experience under a certified, trained interpreter. So is that something that, we should be sharing that information on our website about or regarding to that? I think that's where, if not, I guess we need to be thinking about that sort of thing. Maybe that's something that we can reach out to make sure maybe that's the public relations committee to be, collecting, gathering all those pieces of interest to set up to then publish and make people aware that they have those opportunities. And this is Diana. I agree with you there. I don't know if, I know CIC Online has a mentoring program, and it's only online. So where individuals, they will do a video, sign a video, send it in. They'd send it in to me, for example. I would give some feedback, send it back. We do a Zoom discussion of the video, and we discuss vocabulary and all sorts of things like that. And then they would do it again, or I might give them another video to do. I pick, but I have seen from my experience that the receptive skills for being able to actually speak and get that into English is tough, and the mentoring, that's really important. You need to be able to see those interpreters develop so that they're able to get their English skills ready before more assessment or training or whatever is needed. And I agree that the BEI, it's old, and all the tests, really for receptive, that's a big part of the test. And that's for most of them, that's what kills most of them. Interpreters realize they make a mistake, the communication breaks down, they need to just keep going. Those are the two things that I've seen, I guess, in my experience. So maybe, that's one part of it. There's opportunity for videos that they can practice, they can train with before they even get to the live interpreting with a mentor. That's a good opportunity so that to make sure that they are able to voice well. And those are resources, just in my opinion, we don't want to waste those resources that are out there. Waiting for the camera there. This is Sarah. So just for clarification, you want to see BCHS, or let's say on their website, have published videos for people to practice from? Is that what you're saying? This is Diana. Well, having videos as practice, I think we would need somebody to give feedback, to be able to look at it and, give a response. If somebody just voices a video and puts it away, maybe they're not, and then they come back to it a month later, obviously they're not going to see, that's not right. That's not what, maybe they'll say, oh, I misspoke. Let me go back. We shouldn't be in the business of training people per se, but just referring them to maybe an ITP program or Myriad or other agencies or associations who might be able to provide that kind of service for those interpreters. I guess my concern is that there are interpreters who are still very, very weak in their receptive skills. And let's say we're tying them up with an advanced interpreter, and they're not moving up, they're not getting advanced enough even still, and they can't catch up. It's just what I'm seeing.
This is Mitch speaking. I agree. I think the scope of Laura and BCHS is not to train interpreters, but I do like to connect those referrals and resources. I do like that idea. So yeah, I agree with you, Diana. We do have to identify people as well who have, enough skill to actually, be able to advance as an interpreter and work with that advanced interpreter. The reason why the advanced interpreter, is because their credentials are basically on the line. If you mess up, I'm at risk here in this situation. So as the advanced interpreter, they need to be able to screen essentially and see if these people are worth having as mentees. So, is it worth it? Is the incentive there or not? And then secondly, again, you made a good point. We often will discuss about the test results. And I think the deaf community needs to know that many people, who want to become an interpreter cannot pass the English test. So
this is Linda. Hearing or deaf?
Hearing. So we have, tests out there, and half of them, I mean, it says right here, half of these hearing interpreters cannot pass the English portion. So yes, these numbers are sad. They are. And listening to Representative Colzar, he mentioned that some people feel like the content of the test does not match what interpreting actually looks like in the field. I think that's called validity, for testing purposes, to have specific parameters and measurements developed for the BEI, and then doing all of the pre-work and then the survey and all of that to make sure that that test actually has what the field looks like. They have done all of that before, and we called it the psychometric of the test. Yeah, remember we went on and on talking about that. Are the psychometrics, perfect? Are they up to par and whatnot? But the test is the test. I'm not saying we can't discuss that, but to me, it's an educational, it's an education problem and a recruitment problem as well. We just don't have enough people. So people don't know that, interpreting is even a career. When you go to high school, do we talk about that? Hey, in the future, what are you going to be? People will say, I want to be a doctor, a lawyer, a teacher. It's pretty rare for people to say interpreter because it's not on their radar. I think more and more we're seeing it, especially with the Governor Whitmer, having an interpreter with her all the time. So I think it's getting out there, but that's my perspective. That's part of the problem with the interpreting profession. I don't want to fixate about the test. Of course, we can have discussions about that, but I think there's some other factors I want to face before we really look at the test itself.
This is Sarah. Okay, it's important for me to mention that the validity of the performance test, yes, that's important. The English is a standardized test, and it is a barrier for so many people in our community, and especially involved in the Black community. That standardized English test, it's extremely a barrier. And there are interpreters who have wonderful signing skills, and they might not be able to pass that English test. And CODAs too. And, to be honest with you, I passed it by 2 points. 2 points. I barely got in. And I can sign. I can interpret. And yes, I'm a little confident, but yes. There's many interpreters I've seen that are out there that are people who just graduated from college, and they took the test, the English test, and they can't pass it. And it is a standardized test. And that standardized test, it's a barrier, period. And I want to just say that message out there. I want to make sure that's clear and say that publicly. That the validity of an interpreter is their signing skills. I'm sorry, interpreter clarification. Their signing skills. It is.
Entry is English standardized testing, and it is a barrier, huge, especially within the Black community. Again, many of our Black interpreters cannot work. They cannot work because they cannot pass that test. That English test, that part. I ain't saying they can't sign, don't have the skills. That is a barrier. It's also a barrier for CODAs whose first language is signing, not English. Again, barrier for the deaf people if they want to take the test, because English is not their first language, but that doesn't mean they cannot interpret. Doesn't mean that they can't do better than I do. Many, I see, many. And I'm sorry, but it's important enough for me that I want to make sure that it's clear and on record and it's not your fault. Y'all just rented the test, but That is a huge barrier on diversity within our interpreting community, including DIs, because we see none of them. And I want every time y'all go back to them and say something, ask about that DI test every time. Because we need it. We need it, we need it, we need it. Okay, I'm done.
This is Linda speaking. I was wondering, if it's so, what is it that's so hard to pass about it? You know, is there any modification we can do? Why is it so impossible? I don't know. I haven't seen the test. I don't know how it works. I'm not sure. You know, I understand there's a performance, but the English part, what do you mean? Like, how is it so difficult that can it be translated to ASL, or is there any way that we can modify? Waiting for the camera on these. This is Sarah. They do have example practice tests, yes. But those tests are like taking your GED kind of test, or like the ACT, or that kind of test. So that label of being a standardized test, like, can you pass our English, that sort of expectation? And it's ours, not me. Don't look at me.
Ours is not me or nobody who looks like me. That ours is the system. So that. But just to.
This is Linda. That should be
that,
changed.
Just so you know. Sorry, James.
Mitch, no, sorry, James. This is James speaking. So I propose that all of these discussions is why we set up a subcommittee for this research, to really hone in on all of these barriers. You know, maybe that's why the number of interpreters is so low, the pass rate is so low. This is why we need, you know, all of this discussion, all of these ideas. You can send, you know, more stuff my way, of course, to help guide the subcommittee. But this discussion, we really need to do a lot of research and then propose something, and then hopefully at the next meeting have more specifics about it.
This is Diana speaking. That's a good proposal, you know, to ask. That's the first step. And without passing, you know, you can't advance, can't get farther.
This is Rowan. I do have a question about the ITP for Texas, TEP, sorry, interpreter clarification. T for Texas. Shh. This is Mitch speaking. Right. We gotta wait for the camera. Right. We don't have the power and authority to modify Texas's test. Yeah.
Linda, that's sad.
But I do like the idea of asking. We could ask Texas, you know, what's up? What's up with that issue? Is there any updates? Is there any plans? What have you noticed? You know, especially with the standardized English test compared to other populations, and really respecting their native language. You know, they're not lesser than or subpar. So, you know, that's a good point, Sarah. It is a standardized English test, and it's, you know, related to that systemic oppression of other groups, of other populations. So yes, we could ask Texas and see, maybe are they working on any updates with it, or, you know, anything in relation to that. Yeah.
This is Linda. I'd like to see more, you know, recruitment of interpreters and job opportunities, get them motivated. You know, sometimes I see people that are just like, oh, I failed. Like, you know, I want to see that attitude change. And we, the deaf community, need to hear them out and, you know, see what we can do. We need your ears and hands. This is Diana. I'm going to be the devil's advocate here, but unfortunately I have to say that, you know, people taking the BEI and seeing those failing results, and then they go take the NIC and they pass. You know, tell me how. The national
Right, because
certification.
RID is saying, sure, you can become
But
certified.
it's a different test. Waiting on the camera for Sarah. This is Sarah. I recently found out what the actual difference is. So the NIC, it is an entry level exam. The BEI, the skills part of the BEI 1, for example, it's more proficiency based. And that's the same as the entry level for the NIC BEI 1. And for the BEI 2, that is an advanced. The skills are required to be more advanced. That's for the BEI 2. So that's a more advanced than the NIC entry level. But people want to say, oh, I have the national certification, and that's a national, that word national, that term, you know, they feel like, oh, I'm better than a BEI just for using that word. But in actuality, the BEI, that entry level, and the NIC entry, those are the same. The BEI has several additional levels to advance to, but the NIC has the one. Before, you're right, before they had multiple, but honestly, I know people who have taken the BEI 3 and they pass and they go through all that. Let me back up. Hang on. My bad. People who've taken the BEI 3, they know it's tough. It's a strict test. It's difficult. It's really, really tough. The BEI 2 interpreter correction. But there are people out there who then pay for, they pay more for the national certification, that piece of paper, you know, but then they can't pass the 2. And that's really an advanced exam, more so. So just as a comparison, that's something that, you know, that's a reason that's out there, that the BEI, that's why we use the BEI in Michigan, because it is a strict assessment, and it gauges those proficiency skills. Linda, so are we getting rid of the NIC? Oh, no. Sarah, don't get me to say that. This is Linda. That's my question. I mean, the BEI has those 3 levels, and then they just get the 1 piece of paper for the other exam. I mean, who can we trust? Sarah, it's tough. It is. But that's the reason that we have the levels where you can interpret. You know, many people complain about those, like, hey, but I have a RID NIC, you know, I'm certified. But, well.
This is Mitch speaking. I completely agree with that, and with James, the reason, you know, that's why we're setting up the subcommittee. But again, that's part of the problem we can't solve. So already today, the rep, you know, came to us and mentioned that we need more interpreters. If we get rid of the NIC, then what? I mean, we'll be reduced to the bare minimum. We could change the rules, yes, but if we say the NIC, you know, certified individuals can only interpret for funerals, period, that's it. What are we going to do? That really reduces the opportunity for interpreters to work. So we need to have that, you know, moderation and really focus on quantity and quality. So we here in Michigan, you know, have guaranteed ourselves that we do want proficient, qualified interpreters. And if we allow people to place lousy interpreters in the medical field and in that environment, things are going to get worse. Hearing people think that, you know, everything's perfect as long as you get that person filled, their voicing seems fine, it seems good, but really only that interpreter would know. Maybe they don't even know, you know, how underqualified they are, but in that moment, the assignment gets completely derailed. So that's why this board really has to have those hard discussions and decide if we do want to change the rules eventually for the public and see what they think. James, do you have thoughts? This is James speaking. So I think this discussion, it seems like it would be done and then we get something brought up and it's like, oh, but I want to have, more discussion on this because I have more questions. I don't want to get off the point. I do have other questions that are off the point more so than this discussion, but I want to take advantage of the people who are here in their time. Sorry. Go ahead. Mitch is saying, go ahead. So I'm going to throw them out there really quick. I do have 3 questions. It's more so I want to get your thoughts on these. I don't need an immediate answer. I just want to kind of throw them out there. So my wife has a license under Laura for her profession. And she got this cute little card. And it has all of the information on there for sending in your renewal. It has the instructions on here and they're summarized, succinct, clear, and how much it costs if you're late. How much, time is flexible in terms of the grace period. If you happen to miss it, they put that on here. It's very clear. And it says that her license is still good, for 60 days. And not, if it passes that 60 days, it will expire. I just love that it's very clear on here. So this is a suggestion. It looks like Laura is already using this as a resource. It's perfect. So we could take this, modify it to fit our needs. I mean, I think it'd be perfect for interpreters. If the board wants to take a look at this, you can go ahead. I can share this with you after. And then, for example, it was a beautiful chart that you had, that graphic that you made from July 1st to August 15th, the 45 days of grace time. And then you have the $15 fee, but it didn't say anything about if your certification is still good during that grace period or will it expire. So that's good to add that information on there. And then if their name, if their certification is still good during that 45-day grace period, please contact the system to add that time to the date. I don't want to just remove their name from the system during that grace period. That's a big part of that. We want to have confidence in the profession that they can still work. We want to still see their name on the system. Whatever we decide to suggest on that. And then there was another thing I wanted to comment on. So I've been sitting here and really thinking during this discussion and really noticing, how important it is to have all of this input. And we've had important people here involved in the meeting as well. And I'm looking at online, there's 25 people on there, which isn't bad. And Mitch is saying, I'm excited. That's a good number. And Sarah said there's really 29. And James is speaking. I really want to take a walk around the light and take another perspective. In this room, we have more than one BEI3 certified individual, and there's not many in the state. There's more than one in this room though, and they're not interpreters. And they're not interpreting, in the community right now. So this meeting during workday, during hospital day, it's conflicting during that time that we could be working. So if it's possible, I don't know about BCHS, if you guys have a time restriction, but what do we think about an evening meeting? It would be a less impact, on the deaf community, taking away their resources and services in terms of an interpreter shortage. So, and an evening meeting would be a better opportunity for educational interpreters. They often have a conflict in coming here because they're working at the school. So that would be nice. They don't have to decide one or the other to give up work and watch the meeting, just an idea I'm throwing out there. Again, we don't have to decide on anything right now. But there's been no comment on that really. So I just wanted to throw that out there.
This is Linda. I have a question. I'm curious. On the list, the data of all the names of interpreters, how often are those revised? Are we getting them every 3 months, or what's the outlook like for that?
I'm sorry, was the question how often was the list of interpreters renewed?
the Moise data that we had. There was like when will we get that list of interpreters that everyone who's passed their exams, renewed, up to date? Are we getting that? How often will we see that updated registry?
So we hope to get that out again, maybe in the fall time when we do our data and statistics like we did last time. That is a manual poll. It's a lot of work, unfortunately. And James, I appreciate you bringing the renewal card. I also get one of those. My certified nurse aide program that I oversee also receives those. Moise is a barrier. So when we're talking about barriers, that is one of the things that is frustrating. It's hard to maneuver that system. The Michigan Online Interpreter System is old, it's outdated. We'd love it to be more usable. We are working on getting that funding like we had chatted with, I think last time, about maybe $800,000. We're hoping some of that we'll be able to obtain that funding and put that towards a new system. That being said, it takes a little while to get that up and running. So in the meantime, yes, those lists of interpreters of who's passed and who's doing what at what time does take a little bit of time to generate because it is manual and renewal season's coming up. So if we were to give it to you now, it really wouldn't make a whole lot of sense because of the renewal season.
This is Mitch. I just want to clarify something. I think Linda was, you can correct me if I'm wrong, Linda, by the way. But if somebody becomes certified, say like just recently, maybe, when will their name pop up in Moise? Will it be instantly or is it 3 months later? And then if somebody maybe decides, hey, I want to retire, I'm not going to renew, I'm not going to send anything in, for June renewal season, when will their name be removed from Moise? Do you guys, BCHS, are you guys involved with Moise like on a daily basis or like once a week? How often do you guys modify the data in Moise? Like people whose names are in there specifically, not like Katrina with dealing with where interpreters live and all of those demographics. I'm not necessarily talking about that. I know that's a lot of information, but more so adding or removing somebody, their names from the Moise system.
Sure. So I believe it's 120 days before they fall off of the registry. Colleen, is that correct? That seems like a long time, but also if you're on the other end and didn't renew and had something happen or whatever, we hear a lot of different scenarios. We want to give them ample time to stay on the registry. So we're kind of in the middle. While it's not up to date information, people don't tend to tell us when they retire. Usually they just kind of let their certification expire. But about 120 days. So what's that, 4 months, I think. So we see that we've kind of wavered and changed that over the years about how long should we wait? Is it 90 days? So that's where we're at right now. That can change. And then your other question, I'm sorry.
And then if somebody's
Updates.
added.
Yeah. Is that after we get the results, Colleen, from Texas or from the NIC?
This is Colleen speaking. So, to be initially certified in Michigan, like if you just passed your exam, you submit an application to us and our turnaround is like a couple weeks at the moment. So we've improved quite a bit on getting people initially certified into the system. We are running into this heavy renewal period, but that's the current turnaround, I would say.
Okay. Does that help answer your question?
This is Mitch speaking. So just to clarify, that means if I become a newly certified interpreter, when this person submits their applications, they have to look at the results, make sure everything's good. And then in that moment, they put their name into Moise. Secondly, if someone does not do a renewal or say they retire and they don't send anything in to BCHS, their name will be left there for a while, for about 120 days. But you're telling me that it would have the day on there, if your name is on there, it might say expired. or, past the date of renewal, but their name is still on there. But it looks like their renewal finished in June, say, and now it's August maybe. So you can still see that they're in the system, but it's old, for lack of a better word, right?
Right. Yeah. Well, and also remember, I think we've talked about this a little bit, that we put a message on the website to kind of say, hey, if you see that our somebody's expired, please know it's especially during renewal season that we're processing. So we give ourselves a little bit of time just because we are a small but mighty team and we try to get through everything. But obviously it takes a little time to renew and do all the, especially this year with all the CEs that we have to kind of count out. So there's a couple reasons for that, but yes, I agree with you, Mitch, that it's going to show that they're expired. They're still on the website or on the registry with the note on the website saying they still could potentially be providing services, but they have, is it Colleen, a 45 or how many days do we say on the website? 45 days past their
This is
expiration.
Colleen speaking. So the 120 days was sort of a compromise because there's two different grace periods. For BEI, they have 90 days. And then they have to retest. For RID and EIPA, they have 45 days.
Okay. Does that help? Kind of? Okay. I did want to mention just a follow-up to a couple comments today because I think it was good feedback, good information. We have an interactive map for other provider types. And while you were all talking about, what we need from mentorship and what programs are out there, I was thinking, since you developed a subcommittee on this, if we do have a list of mentorships or programs, I know it's going to be a small map at first, but what we have, and I'd encourage you to look at our website, is you can click on the provider type and select, like, let's say you want to look for a hospital or maybe a psychiatric hospital, a nursing home, and you can select, and then it'll show a map of all the nursing homes in the state of Michigan. And then you can kind of click on it and say, okay, I live in Southeastern Michigan. I want to know the nursing homes here. We can do something similar like that. Granted, right now we're going to have 5 ITPs on it. I think 5-ish, three. Okay. 3 ITPs. And then, however many mentorship people who are out there that put, or programs that are out there that could potentially do it. But it is an idea that we can put out there. Hopefully we'll see that grow. But just something to think about when you're talking subcommittee, at your subcommittees. And then one other thing just to mention with the subcommittees that you discussed, if you're interested, we can collaborate with Texas and talk about with that subcommittee, maybe meeting with them in the subcommittee to have a conversation. We're happy to try to facilitate that. I think it would be really beneficial because sometimes we talk to them and they know when they're hearing us, but it might be different coming from a different source.
This is Diana. That'd be wonderful.
Excellent.
This is April. Just a quick question here. I was looking at this. For all the CEUs, do you have, or I'm looking at C's, I see it says everything that's required. I'm sure this is posted on the website too, but I did notice there is no comment on ethics. And some people were reaching out, asking me often, I guess, can you add that, please? Put the requirements for ethics on there. What certification requires ethics? What doesn't? How many hours? Things like that.
Yes. I believe we have it on our website, a breakdown, don't we, Colleen? There's a visual of CEUs, or am I thinking of something else?
I think we have some FAQs or that.
Yeah.
We can look into that though.
But ethics
Yeah.
is an area for questions. Okay, thank you.
And this is Mitch speaking. I want to support what April just said as well. And when you send out that email for reminders, I don't know if you want to include this information, from those 3 or 4 slides and link that to this, it's related to this, to renewal. I've already been, reached out to by many people asking, what do we need to do? Oh, my 4-year cycle is up. Oh, I need to get all of my CEUs, during that time and send them off. So the sooner you guys email that reminder, the better. And then also, just to clarify, you only want CEUs from the past 1 year, right? Especially if you've been submitting every year during renewal season, you already have that on file. You don't need the entire past 3 years of that 4-year cycle, right? I just want to emphasize that, and you could put that in the email on the website as well. And then lastly, is there anything that we as the board can do to help you during renewal season? I don't mean, coming to your office and
I was
helping
gonna
you
say,
count
we
any
would love
numbers.
Extra help. Who wants to count Cs?
I mean, I would. This is James. But we could get the word out there. We could, relay certain information. There might be some errors. Maybe somebody missed something. I don't know. We could help.
Yeah, I think that would, one, thank you for offering. And I think that makes me kind of want to think a little more about it, because I think getting the word out to everybody is really important. And do we have the right email addresses? Is there, groups that you could share with that maybe we don't have connections with yet? So last year, I'm not sure, I know it's been a little while, but our renewal message did have like an FAQ attached. It had, CE information, things like that. So we anticipate doing that again this year. But maybe somebody looking at that before we send it out to see if there's anything else that we can add to it to be helpful. Also, spreading the word. James, I'm going to look into that renewal card. So I think Moise is our challenge on that, but I'm wondering if maybe I can get our printing services to pull addresses potentially and send out something like that. It would be a little bit tricky just because Moise is a challenge, but I really like the idea. And actually, when Lara BPL started sending those out, I shared it with my CNA program, and I said, Certified Nurse Aid program. And I said, we need to do with this for all of ours. Unfortunately, Moise is a little bit of a challenge. So, but we can try and brainstorm some more. We have some really good IT people back here who are supporting us, Craig, Kyle. So we have some great IT people back here that maybe they can help us brainstorm and do that. So great idea. I'm glad you brought it up again. I know I appreciate that. So, but definitely let us think. And if, I appreciate the offer to help with renewals. So James will be calling you to count those CEs.
This is April. Short comment here. I know obviously everyone is aware of Moise, and that's a big priority that needs to be upgraded. But it's really been a problem with finding interpreters too, because if people like a hospital or a deaf consumer or a school, whatever, if they look at Moise, they need to be able to quickly reach out to interpreters and contact them, and it helps solve that problem. Yes, maybe that we do have a shortage of interpreters, of course, but also we have difficulty with communication within the community, the interpreter, the hospitals. So if we can have that one smooth, efficient database, like right now we have a mass through RID, there are our national agency will just click out, they send a email out to all certified interpreters. It's really easy. That's a big information blast, but Michigan can't because the database. And I understand it's difficult, it's hard to use, but I think that would help approach part of the problem of not having enough interpreters to not just yes, we need more interpreters, but also we need to improve that process of how we can find interpreters to get put in places where they need to be.
Absolutely. And I do realize that since we've started this program, the department has been talking about updating that database. I'm well aware. Unfortunately, I don't know if this is a bad or a good thing. We try to be transparent, right? I've had conversations with Michigan State University, Yale University to do this, DTMB, Salesforce, different agencies to review and update the database and potentially rewrite it completely. And we keep getting hopeful and we're getting there. So I don't want you to think we're forgetting about it, but we are trying to be transparent and say, yes, we are working on this. These are the conversations we had Sometimes things fall through, unfortunately, but I agree 100% that I would love to get rid of that database and have a brand new working one tomorrow. But know that we haven't forgotten about it. We know it's a challenge. It's a challenge for us as well. I mean, obviously, just to pull data for the board, and for those that attend this meeting is, I mean, we've shared, it takes a while, us having to check CE totals by hand, I mean, manually. So we want it just as much as I think the community does as well. So, but I do want to just share that I recognize we keep saying we're going to do this. We haven't forgotten, we are still trying, but we'll continue to be transparent on where we're at with that.
Nope. Diana, do you want, this is Sarah. Okay. Thank you. Thank you for all you've done for us. Every time I'm ready to ask a question, say something, and I'm like, oh, all right, well, they already answered it. It's right there. So thank you. Thank you. For all that you guys have done over the time. Appreciate it.
And we definitely appreciate having an engaged board. I was telling Marlon today, I'm like, we are so lucky to have a board that is passionate, engaged, and wants to help. So we appreciate it. I think we have a great partnership.
Okay, thank you. We can make a motion for what? What are we discussing? We'll need to do research and then have a documented list of resources as well. Because there's none in relation to the test. This is James, by the way. I feel like participation is the reason we see not enough interpreters. Yes, the test itself will show up as an issue, but when we see more evidence in relation to this of what is the barrier, what's blocking people from moving on, that we'll do that work in the subcommittee. But we need to see exactly what's wrong with the test first. This is Mitch speaking. I agree. Thank you. So now are we ready to move on to public comment? Yes, I do want to make an announcement. Before people stand up, we typically stand at the podium, but we noticed that especially on Zoom, the lighting does not look well. So if you plan to sign your public comment, please come up here to where the interpreters are, to this backdrop. We'll kick them right out and you can stand in the spotlight, okay? Okay, so I will move it over to the department and you can proceed with public comments.
This is Heather Keel. Our first in-person public comment is from Warren Coryell. Warren, you may come to the interpreter stand.
But I hate to kick you out. Okay, I forgot to bring my winter coat. All right. Well, my name is Warren. My last name is Cortrell. I am from Grand Blanc. So, wow. Diana had mentioned 87% of doctors refuse to hire interpreters. And I'm talking about live interpreters, face-to-face, in person for the deaf community. That number is appalling to me. That's really breaking the law. That is breaking the law. They are ignoring us and our needs and neglecting us, not only doctors, but hospitals in general too. I can give you two examples right now. McLaren, which is in Flint, and then also Genesis, which is in Grand Blanc. They refuse to provide live in-person interpreters. They want to do video remote interpreting on the iPad. And I know you guys have heard this story many times. I'm not telling you anything new. We all know that. But for documented purposes, I really want to get that down. I want to make that comment. Hospitals really all over, it's not just those two I mentioned, but all over Michigan are not following the law. And another thing that bothers me is that interpreting agencies, some of them also are not following the law. They're putting BEI 1 interpreters in place for a medical assignment. That is breaking the law right there. And then the lawyer, legal profession in that setting, there's laws being broken there as well. The interpreters provided are not qualified. I mean, one time I went into a lawyer's office and we were going back and forth talking about things, and I was like, hey, you need to provide a sign language interpreter. And the lawyer said, no, you get your own interpreter. And I had to say that's breaking the law. And his answer was, so what? Sue me. He said that. He said, sue me. And I was like, really? The reason that I'm mentioning all of these examples of breaking the laws is because they're breaking the law. Lara is a licensing agency. It was regulating that. What's going on there? You guys have the power to do something. I think many other agencies who are out there need to enforce the rules. Like, for example, things that control alcohol and drug regulation, things are, enforced there. That's important. We need to enforce these laws. Somebody needs to be following through to make sure that these laws are being followed. So it seems maybe Lara is not doing that. Why are we not taking action on that to make sure that places like hospitals and legal settings and really any medical setting, even educational settings, maybe, prisons even, is Lara not enforcing this? Are we not making them follow the rules? Where is that enforcement? Where is that? Because we really need to take action on that. Because today, I mean, with all of these examples I mentioned, a lot of people will look at them and think, so what? We don't have to follow the laws. Nobody's going to enforce them. And they know that. So they basically do what they want. And that's what's happening. They do what they want. They think about money and the capital first instead of the deaf person as a human and their rights. They choose for us often what our access looks like, and that's not right. So we really need to enforce those laws. We need to take action on that. And I do have another topic I want to talk about: video remote interpreting and also video relay services. I mean, there's nothing new. We've talked about these issues for a long time, but a lot of those interpreters on there, VRI and VRS, are not qualified. I really just sit there and say, oh my gosh, these people cannot even sign. Some of them are okay, but I often feel shocked that these VRI and VRS companies are hiring these interpreters. They're, again, not following the law. And some of these people are also out of state. And these deaf people are stuck. We can't make these people follow our rules in Michigan. Michigan does have really strict and good rules in place compared to the rest of the nation. So we are doing good in that, but I'm just wondering about those situations on VRI and VRS, and we have interpreters out of state and underqualified interpreters. If I'm honest, it kind of disgusts me. I want to know what's going on with those underqualified interpreters. And I know it's ultimately a federal issue. I am aware of that, which is separate from state discussions. I'm aware of the FCC and all of that. But if we want to change this for the state of Michigan and eventually for the nation, I would like to see Lara contact the FCC and make some sort of dialogue, create some sort of conversation, and also state legislation in here in the state of Michigan. I want, both of these entities involved, and I really want to try to get the FCC to get more strict on legislation, and try to get the FCC to maybe see what the Michigan rules and laws look like and how they can use our laws as a model. So those are my thoughts. I want more enforcement and I want more outreach with the FCC and legislators to really try to change and impact the nation so that we can get better interpreters on video remote interpreting, on video relay services as well. Thank you. Thank you, Mitch Singh.
This is Heather Keel speaking. Our next in-person comment is from Deb Atwood.
Good afternoon. What an emotional day. Wonderful, wonderful, wonderful. I'm going to follow right behind this gentleman here. We talked about the shortage of interpreters and why there's such a shortage of interpreters, and we know why there is basically. But let's go with the VRI, and I've said this many times, but again, I think there should be some regulations with these out-of-state companies who are bringing interpreters into our state. How many of the deaf people know that they can ask for their certification, they can ask for their card? I think that education needs to get out there. How many of those interpreters won't show their card? I hear that happening more and more now, that these interpreters from out of state won't even show their card. They refuse to do that. So the deaf people have to ask for another interpreter. How long is that going to take to get another interpreter there? And we're going to go through all this time. The doctor gives you 15 minutes for an appointment. Is that going to happen? I know I'm preaching to the crowd. And then the amount of money that these out of state businesses are paying these interpreters. I'm going to speak to that point again, for our interpreters in our state. And again, I don't blame them. What are they paying them? $55, $65, $85 for a 15-minute meeting? We'd all do that. I wouldn't mind sitting at home, my black shirt, my pajama pants on, and make $85 for 15 minutes. Why not? But that is taking away from our community, is it not? I can't pay that. I don't know any agency that can meet that. So that is definitely, it's an issue. Who enforces that? And I'm going to piggyback right up on here. I don't think it would be Laura. I could be wrong on that. Who enforces these out-of-state companies bringing out-of-state interpreters into our state? All these interpreters here have to have all these endorsements and everything that they have to have, and you have to pay for it. You have to do all that, but they don't have to. That's not fair to you. That's not fair to the deaf person. So who enforces that? Who polices that? That's what I want to know. We are excited. You all were talking about mentoring and such. We are almost ready to roll out our advancing ASL interpreter in West Michigan. Thank you very much, James, for helping us in that. What we are doing is we are setting up BEI 1s for observation only at this point in time to go in with endorsed interpreters into medical settings in the appointments. We have got contracts in place. We've got releases from area hospitals, and there's special rules and everything, and we're going to play by that. We've got mentors in line. We're going to try to get mentees as it is. So at least they are getting observation time. We would like to eventually move to that hands up time, but as an interpreter, absolutely. They all have that same concern, and who wouldn't? So our next piece is that we are getting the deaf community on board, and they're going to be signing a release allowing that mentee to come in. They can kick them out or they can remove them at any time, whatever they want to do. It's all up to that deaf person, but that's what we want to move on to. So we're very close on that. We've got sponsors, we've got funding, and we're very excited about doing that. The other thing I wanted to talk about is there was a comment about regarding letting the deaf, blind, and hard of hearing communities know about events. If we could at least get it out to the agencies. We all have Facebook pages. We all have websites. We all have these close connections to the communities that we're in. We can get it out on our social media. At least that's a good place to start. You all know of all of the agencies and all their social media. So I think that'd be a wonderful place to start. We also in Grand Rapids now have a senior citizen group that meets. We're up to, I think, 35 people. So I think we're going to talk about having Laura come in and maybe present to them. Maybe somebody from the board wants to come in. And again, it's that face-to-face. You all know that. Once we get in front of somebody and they see our community and they hear our community, then they go, oh, we get it now. So you're exactly right. We just got to get in front of their face. Thank you.
Thank you.
To confirm, are there any further in-person public comments? With there being none, I will turn it over to Tammy Bagby if there are any or Zoom comments to be provided.
At this time, we have a couple of comments. Justine Bryant, regarding ethics for renewal, does the state accept PPO, power, privilege, and oppression hours as ethic hours in Michigan? The second comment we have is from Karen Mrazik, Mrazik, and bear with me. As Sarah mentioned, the NIC is now considered a generalist exam, and this is a delineation from previous forms of the exam, but RID and CASLI now, as they have modified their test, have retained the same name as previous iterations of the exam. I am dating myself, but way back when there was a Michigan QA test, interpreters holding those credentials were locked down upon by nationally certified, AKA RID certified interpreters. And even the QA was supposed to be a stepping stone to the ultimate goal of obtaining the national credential. And that old perception fed the inspiration for and creation of the original rules and regs for PA 204. As it stands, NIC is listed as a greater certification than the BEI, our state test, in the rules and regs. Interpreters holding NICs are allowed to do more than advanced BEIs. Even though the deaf, hard of hearing, deaf, blind communities and the interpreting is starting to notice perhaps the NIC certification doesn't mean what it used to, I hope that some consideration to the point is given in your draft of the suggested changes to the rules and regulations. Also, as James mentioned, evening meetings have been asked for many years by myself and others. These daytime meetings are near impossible for educational interpreters and even freelance interpreters to participate. I am pleased to see that we are now posting the live recordings on the LARA website. That is an improvement, but participation is still difficult if you're only watching old recordings. Last but not least, thank you to all of you on the board for your continued work towards bettering our profession. I am hopeful that with all of your involvement and the new staff at LARA seem to be so receptive to your advice, better things are on the horizon. End comment. And our final comment is from Shaylee Kales, Kales. How can we dispute someone certification with certain things? Like an interpreter who is a medical endorsed cannot understand me in a simple scenario, and they are medically endorsed, even though they cannot understand a simple comment. Who do we contact about this? How do we go about it? This interpreter also said things that I did not say and caused a major miscommunication in an appointment. I see no hands are raised on the Zoom comments, and that is our last comment.
This is Mitch speaking. I do want to inform you that we hear you, those of you who made a comment. Sometimes the rules don't allow us to comment to each of you individually, but I do want to say that I acknowledge and hear your concerns and thank you for your feedback, and we are taking notes on them. We want to make sure that this information is documented. So before we close, I want to ask if there's any announcements from the board.
This is Linda speaking. May 23rd, the Attorney General will come to my building. There will be a presentation about identity theft and scams, and that's in Battle Creek. We just look forward to the presentation happening, and I want to emphasize, I know it's a presentation and we just want to spread the word. I didn't think that it would be so informative, but it is really, really interesting, and I want to invite everybody to come.
And this is Rowan. Yes, I have an announcement next week, May 17th. It's Earthview High School, Northview High School, sorry. Will have an event we're calling Northville PAH, P-A-H, which means finally. A lot of colleges are coming to this event, and a lot of businesses, stakeholders in relation to the deaf community are coming to this event. We're going to have games, awards available, swags to give out, little gifts and all of that. And it is free admission. You don't have to pay anything to get in. Matt Hamel. He's a pretty famous deaf guy in the MMA. He will be there as well at our event. He will be presenting, and he'll be showing some wrestling demonstrations as well. So if you want to get in, see his presentation, those tickets are $10. So yeah, go ahead, Google Northville event called PAH, P-A-H, and all the information is there.
Diana, nope, I don't have anything. Thank you. This is Sarah. I just wanted to say congratulations to all of our ITP program graduates this spring. And I hope to be able to attend, or I had the pleasure of just recently attending commencement and seeing one of my mentee students graduate. And I just want to say congratulations to all of the ITP program students who just recently graduated. And I look forward to working with you all in the field and in the future and for years to come.
I have nothing. This is Mitch.
This is April. Yep. Short comment. Well, really, a lot of my comments I defer back to the subcommittee. But a lot of the data that I am working on collecting from that we already have heard from the state, that's already been collected, that shows specific requirements from every state. And I have a big spreadsheet that it's interesting to see the comparison along with Michigan. And they're strict, they're not anymore. We're moving up. But soon, this coming fall, we'll have the ITPs grant. LCC was just approved for a grant. And we filled out paperwork and sent in, and we got this grant for paying mentors. And this is deaf, hearing, doesn't matter. We will be bringing in mentors to work with our students. And we're trying to come up with ideas on how to trust that gap and see improvement and skill. And I do want to expand on that on the next meeting in October when I present about LCC information. But this is just supposed to be the first step, just to let you know. This will be starting in September, and I'll be sending out an email around that time to let you know, just to be on the lookout for contracts with deaf individuals and hearing individuals too. And that'll be to mentor with students again. This is for pay, not for volunteer. It would be pay per hour. And so I'll be more to come on that, and I'll expand on that in October in the next meeting. Thank you.
And this is James. I have nothing.
Linda, what? Really?
Yeah, it's shocking, right?
This is Diana. Oh, I did forget. I wanted to say, thank you. To Mitch, to Sarah for your service on the board, and congratulations to Linda and Sarah. Thank you so much for accepting. And she's still there. She'll stay. But still, thank you. Thank you for your time, your effort, your work. We really, really appreciate it.
Thank you. So do I see a motion for adjournment? Rowan, I second adjournment. Yes.
Diana, second.
Okay, meeting has been adjourned.